Do you know how important your thyroid gland is for your body? Hidden away in your neck, the thyroid gland is a small butterfly-shaped organ that plays a crucial role in keeping your body functioning smoothly. This unsung hero produces hormones, mainly thyroxine and triiodothyronine, which have a profound impact on your body's metabolic rate. They regulate how your body uses energy, impacting everything from your heart and digestive function to muscle control and brain development. These hormones also have a hand in maintaining your mood and bone health. Imagine the thyroid gland as a conductor, orchestrating the symphony of your body's functions with its hormone production. And just like a symphony, if one part is not working correctly, it can throw the whole performance off. This is why it's so vital to keep your thyroid gland healthy. Now that you understand the significance of your thyroid gland, let's move on to discuss some common disorders and diseases that can affect it. First on our list is Graves' disease. This autoimmune condition is caused by an overactive thyroid or hypersecretion of the thyroid hormone. Now you might be wondering, what triggers this overdrive? It's attributed to abnormal antibodies of the body, which interestingly mimic the thyroid-stimulating hormone of the pituitary gland. In turn, these antibodies stimulate the thyroid gland, leading to an excess production of the hormone. Graves' disease is more common in women than in men and typically shows up between the ages of 30 and 50. The symptoms of this condition can vary, but some of the common ones include nervousness, increased metabolism, sweating, and weight loss. These symptoms are due to the elevated levels of thyroid hormones in the body. The effects of Graves' disease can be quite significant, affecting both physical health and quality of life. So it's crucial to seek medical attention if you notice these symptoms. That's Graves' disease for you. Now on to the next thyroid disorder. Next, we have simple goiter. This condition is a result of the thyroid gland becoming enlarged due to the hyposecretion or insufficient production of thyroid hormones. One of the primary hallmarks of simple goiter is the formation of extrathyroid tissue, which causes the gland to increase in size. But what causes this condition? The answer lies in a persistent deficiency of iodine. Iodine is a key component in the production of thyroid hormones, and when it's lacking, the body can't produce enough of these crucial hormones. This deficiency leads to a relative lack of the hormones T3 and T4 in the body, triggering the enlargement of the thyroid gland. In some cases, this increased size can even cause damage to adjacent tissues, such as the esophagus and nerves. That's all about simple goiter. Now let's learn about a thyroid disorder affecting children. The third disorder on our list is cretinism. This is a disorder caused by the hyposecretion of thyroid hormone in children. This lack of thyroid hormone can lead to a number of severe developmental problems, including mental retardation and physical abnormalities. Children suffering from cretinism often exhibit slowed growth, resulting in a disproportionately sized body. They may have short limbs, a broad, flat nose, and a protruding tongue. But what causes this condition? Cretinism can be due to a genetic deficiency of the thyroid gland, or it might be related to maternal factors such as a lack of iodine during pregnancy. It's a stark reminder of just how crucial the thyroid hormone is to our body's growth and development. The effects of cretinism can vary depending on the age and physiological activity of the individual, but it's usually more severe in children than in adults. That's a brief look at cretinism. Now, let's move on to our last disorder. Finally, we have thyroid tumor. This condition is characterized by abnormal cell growth in the thyroid gland. While malignant or cancerous, thyroid tumors are relatively rare. Benign tumors, including single adenomas, are fairly common. Don't let the term benign fool you though. Even these non-cancerous growths can sometimes overproduce thyroid hormones, leading to a condition known as hyperthyroidism. This can cause a myriad of symptoms, from rapid heart rate and weight loss to anxiety and irritability. And in older adults, there's an additional concern. In some cases, these benign tumors can become malignant. This transformation is not fully understood, but it underlines the importance of regular checkups and timely intervention. By catching and treating these tumors early, we can significantly improve outcomes and quality of life for those affected. That covers thyroid tumor. Now, let's summarize everything we've discussed today. Now that we've discussed various thyroid disorders and diseases, it's time to summarize. We've journeyed together through the complexities of the thyroid gland and its associated disorders, beginning with Graves' disease, an autoimmune condition characterized by an overproduction of thyroid hormones. This disease, more common in women, can lead to nervousness, elevated metabolism, sweating, and weight loss, among other symptoms. Next, we dove into simple goiter, a condition marked by an enlarged thyroid gland due to the underproduction of thyroid hormones. This often results from persistent iodine deficiency, leading to a relative lack of T3 and T4 in the body. This enlargement can sometimes cause damage to adjacent tissues. Our exploration then led us to cretinism, a disorder resulting from insufficient thyroid hormone in children. This condition can lead to mental retardation and disproportionate body size. Causes can range from genetic deficiencies of the thyroid gland to maternal factors such as a lack of iodine. Lastly, we touched on thyroid tumors, which, while typically benign, can sometimes become malignant in older adults. Even benign tumors can cause complications, such as hyperthyroidism if they produce excessive amounts of hormones. These are just a few examples of the numerous disorders and diseases that can affect this small, butterfly-shaped gland at the base of your neck. Each of these conditions underscores the importance of regular checkups to detect and manage them early. If left untreated, they can lead to more severe health complications. Despite its size, the thyroid gland plays a significant role in maintaining our body's overall health and well-being. It's responsible for regulating our metabolism, growth, and development, among other things. Therefore, staying informed about thyroid health and being proactive in its care is not just important, it's essential. Remember, your thyroid gland plays a crucial role in your body. Stay informed and proactive about your thyroid health.